So I would like to welcome everyone for coming today. And I also want to thank you all for coming, both our panelists and our attendees. And today is day 4 of Femme4STEM, the second to last day, sadly. And my name is Kayla Lim, and I'm one of 2 founders of this project. In partnership with the Ronald Reagan Citizen Scholar Institute, Femme4STEM is a CSI project that my partner, Ria Manimaran, and I have worked pretty hard during the past few months to bring to life. Working with high school students to create a positive impact, Royal High School Citizen Scholar Program encourages students to design a project that will improve the lives of those in their community and further beyond. We've decided to acknowledge our appreciation for more involvement between women in STEM than to host our project during the first week of International Women's History Month, which is this week. That's why Femme4STEM was created with this intent, introducing students, especially young women, to professional women and providing a forum for questions with no bounds. Now, without further ado, we would like to introduce each of our featured panelists for today so we can all get to know them a little bit better.
All right, so first off, I'd like to start with Dr. Preeti Vijayaraj. Preeti is currently a principal scientist at Boehringer Ingelheim Pharmaceuticals. However, her prior work experience includes being an assistant professor in biological sciences at UCLA.
And our second panelist for today is Dr. Jerry Lim. Currently, Dr. Lim is a practicing pediatrician and partner at Pacific Coast Pediatrics. And prior to a private practice, Dr. Lim was an Air Force pediatrician with an education from Baylor University and the University of Texas Medical Branch in Galveston, Texas.
Now, our topic for today's event is navigating the workplace during COVID-19. What exactly does that mean? Well, we're all very aware of the pandemic, and ever since it began nearly a year ago, our traditional view of the workplace has changed. In laboratory research, as well as medical offices, it's become necessary to take extra precautions in also typical working situations. Ultimately, these changes have transformed the way we work and see the future of a physical, in-person workplace. So, before we start off the interview portion of the event, I just want to emphasize that we really want to hear the opinions of everyone watching the webinar. So throughout the event, we have the Q&A function enabled. Send in your questions and comments, emphasis on the comments part because we'd love to hear your thoughts. And after the interview round is over, we'll address everything that's piled up in the box. Okay, so to begin, I just want to ask the panelists this question. Have you been physically present in your workplace since the beginning of the pandemic, or have you recently integrated to back in-person work? In either.
We've been in physically at work.
Oh, me too. But I've been in an extremely unique situation, actually. So as Ria mentioned in the introduction, I'm sorry.
No problem.
I used to work as a research faculty at UCLA with my research focusing on lung diseases. And in February of last year, I accepted this job offer at Boehringer Ingelheim as a principal scientist and was scheduled to start on site in April of last year. But then COVID hit in March of last year. And I was still working at that time at UCLA. And very quickly, actually, we started to work on COVID research. And since we were doing essential research, UCLA allowed us to continue our work. And so we quickly came up with some kind of like scheduling calendar system where there were always, we were only a limited number of people in our labs at any given time. We maintained social distancing as well. And so also, since I was just wrapping up, that just meant that I had to be there at odd hours and long hours just to kind of make up, or rather to kind of adjust around the people who basically allowing everybody to come in and finish up their work as well. And then I ended my work at UCLA on a Friday, and on a Monday I started my work at Boehringer Ingelheim. And I actually started off site, and I was actually considered patient zero in the sense as I was the first employee to be hired um, remotely. So I, for a month or so, I continued to work at from LA, and then a month later, because at that time there's initially a lot of paperwork to get done, so I was there, and then when I moved to Connecticut and I went on site, I was greeted by my colleagues wearing masks, and then I did have a lot of work on site, so I did start going on site. Of course, we maintain social calendars, I mean scheduling calendars, maintaining social distance, our masks, and the usual. And I think the only thing I'm worried about is when this whole pandemic ends. I'm not sure I'd recognize most of my colleagues because I've never seen them without masks, and it's the same for them as well. So I've been physically present at my work site at two different places. So it's like kind of a weird situation, but made it happen.
Now, I wanted to ask, when it comes to working in person, since both of you have experience with that, what were your like personal feelings? Like, I'm sure that even just the thought of going back to school in person is scary because you don't know whether or not you'll contract COVID. So, what were your personal feelings and thoughts when it came to going back in person?
You want to go first, Jerry?
Sure. So yeah, so we never stopped in person, but we did cut back our appointments drastically when the shelter in place came in California, so that the number of patients we saw in person was probably less than half what we normally would see. And then we had less doctors in the office at a time as well. So even though we never went completely off-site, it was drastically reduced. And I would say in the beginning, when it was just starting, we didn't know much about it. It was a whole new world, a whole new thing. And given that most places struggled with getting the right amount of PPE, it also made it a little more scary. But we quickly were able to get what we needed to feel protected and adjusted our practice, which I think we'll get into the next question some. And so, you do what you need to do, but it certainly was unknown territory for sure.
And in my case too, I think since we normally do work with biological specimens, we do get access to patient tissue at all times. So we've been trained to take all kinds of safety measures at all times. So we are used to regular PPE, but I think the most difficult was to have masks on at all times with the goggles that we would normally wouldn't wear masks. We would wear, of course, our safety goggles and gloves, but anything that would be could potentially get aerosolized, we would work under a safety cabinet. So we never needed masks on regular basis. So I think the most challenging for us, or in general, the feeling was that mask with the goggles that would get fogged up, and then would just make experimentation a lot more difficult. But yeah, eventually we got used to that. But I think that was in terms of safety, and that was never a threat in the sense as long as we knew that we were washing our hands, wearing a mask at all times, and maintaining social distance, we were kind of safe. So the fear I never really had. Yeah.
Great, thank you. So I think this is a perfect segue into our next question. And so, I mean, for me personally, I know that COVID-19 has caused many changes in kind of my time commitments. Like, for example, I still am a taekwondo athlete, but I mean, because of the pandemic, I'm not able to go in person anymore, which obviously takes a huge chunk of my time out. So we wanted to ask how COVID-19 has affected the way you manage your work and prioritize your commitments.
I go first.
You can start.
So in terms of work itself, actually, it has not affected the quality or the quantity of our work. So I think we just had to get a little creative in the way we kind of navigate or organize our time. So sometimes, which would mean if we had to go in early or a little late in the evenings or on the weekends, just in order to kind of fit our the scheduling calendar requirements, we did it. But I think in terms of what we were able to produce in terms of data for the research, in my opinion, at least in my area, we were not affected. In fact, there was more pressure, if anything at all. And so we delivered.
For us, it was almost in the beginning there, I would say daily to weekly, we were adjusting our practice to make safety measures. So besides cutting back on our schedule, we, as you saw in many places, we put the physical barriers for our administrative staff so they wouldn't have to come face to face with patients. We stopped walk-ins, so literally people had to call before they could even get into the building so that we could screen them out. Quickly, we got onto telehealth like so many other practices where we did some patients in person and a lot of patients by video, at least to start with. And that's what we've continued to do. So, a lot of our practice has to do with making sure newborn babies are staying healthy. So those well checks early on, we didn't really want to stop, and we kept those going so that we could make sure the babies were doing well and also able to give them their vaccinations. But the sick visits, which, amazingly enough, went way down. And I think part of it was because people weren't mingling and, sharing their germs, but we still, had some sick visits. And so that would be by video. And that's been picking up through the months. But we, the telehealth has been an interesting thing because not only did us doctors have to figure out how to evaluate our patient on video, but a lot of the patients, had to become more tech savvy than they were comfortable with. And if you can imagine doing a video visit on a toddler trying to do their exam while they're looking at the video, it's pretty interesting. I think we're getting better at it, and I think a lot of our patients are learning better how to do this technology because it's been the way of the world now for this last year, not only for medicine, but for family connection and meetings and other work areas as well. So that's been a big adjustment. We also, because of trying to keep people safe in the building, we started doing parking lot exams for the things that could not be handled only on video. So we would meet the patient out in the parking lot and examine them for what we couldn't do on video. And then eventually we actually made a little space out between two of the buildings so that we can go out there instead of having to see them in their car. And then our practice also went to the extent of making a negative pressure room so that if it couldn't be done outside because it was a more private type of issue, they could go into the negative pressure room, and it's, the germs are contained and filtered out so that we can have that option. Getting the PPE was interesting, but we were able to secure over time, and now it's not as hard to get. But I think early on we instituted a lot of those things with the masking, the face shield, the hand sanitizer, right when all the staff and patients came in, and I really think that helped our practice from spreading it inadvertently or patients coming in that inadvertently had it. So it's been a process. It's been a huge learning process, but and every day still we're changing things. But I think it's amazing how far we've come and all the other practices in the world.
Thank you. So something I'm kind of curious about is there's obviously been shifts in the workplace and kind of how it looks, but I wanted to ask, have you also seen shifts in communication with like your coworkers? Like, has it been harder, or has there been instances where it was really hard to communicate with them? And if we could start with Dr. Lim on this question.
I wouldn't say with coworkers. For us, another thing we did is the doctor's office is where we normally kind of do our charting. We made it so that we were social distance as much as we can. Instead of the desks side by side, we have them all facing the wall so our backs are to each other. But we still could communicate with each other enough. And then our practice has the benefit of having two physical buildings. So we were able to social distance more that way because we could use both buildings and keep ourselves and our patients as socially distant as possible. So, no one was in the waiting room. No one was waiting in line to be checked out at any, back area. Everybody was just in their personal exam room and checked out from there. And so I don't think the communication between staff was a big issue for us.
And in my case, one-on-one meetings completely was not allowed. So which means any kind of meeting, any kind of, even if it was just to ask simple, to discuss like a 5 minute discussion, had to be scheduled because of everybody is working on their like calendar appointments, So I think that became challenging at some point because people were just back to back meetings scheduled virtually. And that could also get exhausting, which it was the common complaint that people were talking about. But our one-on-one is just completely became virtual. So that way it affected us in the sense of not being in the same room. I think the other thing is another way it affected us was just the time that we were spending in scheduling these meetings that were not necessarily was not needed actually. That was another problem we had. Other than that, yeah, it was just these two. I just think we made it happen. I mean, I think that's the important thing, that it worked. But yeah.
Thank you. Okay, I think we lost Ria, but while we're waiting for her to connect, I'm just gonna ask the next question. So I think something that is really unique about COVID-19 is how suddenly it really shifted life for pretty much everyone, not only healthcare workers or people that are working in person, but really the whole population. And I know for both me and Ria, I mean, both of us got out of school immediately and we haven't been in person since. So I think we've both grown really comfortable with staying at home and kind of practicing social distancing, as in not really meeting with anyone because of just how comfortable we've grown. So we wanted to ask if you could give us your take on how COVID-19 has affected your perspective of life kind of outside the workplace. And Preeti, if you want to start with that question.
Outside the workplace, I think it has changed quite a bit. And I would say in a more positive way, I would think, because I think the bright side, one of the biggest things that I'm super happy about is that I get to do a video chat with my father and my sisters every day, which never happened before. I mean, we only did audio calls, but video calls is somehow it's so much different because especially with my father being back in India. That way, I think I'm very grateful for this time that I get more time to do family calls. Just because the nature of our work is flexible, our timings are kind of flexible. And I think while I was at UCLA, I never had my nights and weekends to myself because of the nature of the job. Here, I'm beginning to reclaim my nights and weekends, and I'm very appreciative of that. So I get quality sleep, which I also really am appreciative of. And importantly, I get to spend a lot more time with my husband. We are mastering several board games, which is really nice compared to what otherwise we're catching up on movies and talk shows. I think the thing that's the most negative impact that it has had is on my fitness schedule. I basically love to work out as a group, and I don't necessarily enjoy working with the TV in front of me or you know. So
Definitely.
yeah, my fitness life has been affected significantly, but I think my personal life, I'm very thankful to have a job. I think, given that, I'm very thankful that I also have uh, become closer to, not closer, but I think I've started to love my surroundings a lot more, I would say.
For me, I would say day to day outside of work hasn't changed drastically because most of the days I would come home and have a quiet evening, just chilling out after a busy day at work. I think what's affected me most outside of work is not being able to have that freedom of going to see family whenever I might want to. And our families are spread out, but I haven't been able to see my mom and dad in person for over a year. Thank goodness for Zoom, though. Like you were saying, we are connecting more by Zoom, and in some ways, that's brought us closer, even though we haven't been able to see each other in person. But that's been hard. That freedom that we kind of took for granted before, to just hop in a car or hop in an airplane or go get something to eat at a restaurant. That's been a little tough, I would say. um so I'm looking forward to when hopefully that won't be that way anymore.
Yeah, I think I totally empathize with both of you on that. So I was also informed that there is a power outage in Simi right now. So I think that's what happened to Ria.
Oh no.
So if any of you lose power, don't feel pressure to come back. Just make sure that you guys are safe and that everything's okay with you and your family. Okay, so moving on to the next question. So since COVID-19 is mostly likely here to stay, of course we have the vaccine, but I feel like it'll be here pretty much affecting us forever. So we wanted to ask, what effects of the virus do you think will last beyond this era of pandemic? And Dr. Lim, if you want to start with that question.
Okay. For my work, I really think telehealth or video type appointments are going to be ongoing. I think there's a niche for that people have gotten used to now, and that works well in certain situations. Certainly, it does not replace in person on a lot of things, but for some things, it's been a very good tool that we've discovered, and I think that patients enjoy. Um, I also think because of the beginning of the pandemic, when PPE was so hard to come by, uh, we'll probably be hoarders of PPE for a while. As long as we can get a hold of it, we'll probably keep a better stock than we did before, because we didn't realize how important it was. And who would have thought we would live through a pandemic in our lifetime? But I'm hoping this experience, makes all of us as people more mindful that, pandemics can happen, and there might be another one coming in the future, and maybe to be more prepared and open to thinking about those kind of possibilities and what we can do to prevent them.
I think the long-term effects of COVID, you're going to have both positive and negative, right? So in the positive sense, people are going to be more aware of their hygienic habits, and that's a good thing. And probably people are going to have a better self-realization as to like what's actually important. Is it just, it could be anything. What makes them happy, what is most important for their life. I think that self-realization probably would be another positive outcome of this whole COVID. In terms of the negative effects, I'm a little concerned about the long-term effects or the health effects that are associated with COVID, especially the fibrotic component, which right now there are no drugs that could reverse fibrosis. So I'm a little concerned about that effect. And also there are a lot of long-term lingering effects, temporary, could even be like permanent effects. So And I think also the economic recovery in general is also going to be very, very slow. So yeah, these are what I think um, would be some negative effects while we come out of this COVID era.
Thank you. So I know we did address kind of the negative effects, but we also wanted to ask if the pandemic has kind of shed light on anything that needs to be addressed. And if it hadn't, like what we mean by this, if it had been later addressed before or after, I guess, the pandemic, there could have been more issues. And I know, Dr. Lim, you spoke about the PPE and how now we know how prepared we need to be, at least have an idea of that. So kind of similar to that, are there any, I guess, issues that you think were revealed because of the pandemic? And Preeti, if you want to start with that question.
Some things that were about actually how unprepared we were, right? And how people were resisting mandates or suggestions from the CDC. I think we could have been more prepared that way. I mean, or at least just followed guidelines and followed policies and not resist. Yeah, I feel like that was a problem.
Yeah, I'll piggyback on that, and I'll just say again about the, things were revealed as time went on, but I think if there was more of a unified guidance as far as especially the masking, when it became apparent that, that was one big way the virus was transmitted, I think that could have been more emphasized as a cohesive, mandate throughout the United States. I think that would have been helpful. The other effect I was just thinking about when you were mentioning some of the physical effects is we're seeing a lot of psychiatric effects of this pandemic as well. There's so many, in my field, so many adolescents and young adults that are really struggling right now with this pandemic and how they've been isolated, and that's another big problem going forward that we're going to have to tackle.
Thank you. Yeah, I think it's really interesting how, or not interesting, but I think it is important how we're noticing the psychiatric effects and how we need to, I guess, take action on that. Okay, so our next question is hypothetical, and it reads, if you could go back in time and change a policy or social practice that occurred last year during the height of stay-at-home orders, what would you encourage or advise against? And Dr. Lim, you can start on this one.
Yeah, I think it's still pretty much the same, more paying more attention to maybe what other countries have gone through with pandemics in the past, which, we know a lot of them were already doing masking and being, safer in that respect. So I think if there could have been more of a cohesive guideline on that, that's what I think would have maybe helped.
Since you say it's hypothetical, I would say probably I would mandate nationwide masking, because I think, like Dr. Lim said, it's such a simple protection. Like, it's so easy, it's cheap, it's effective, and if everybody did mask up, that would have, I think, if that policy could have been made mandatory. I don't know whether it's possible. I mean, people are going to argue that you're infringing on the civil rights, but I think that would have really, really helped kind of cut it down. We would not have been in this. This would not have lasted this long. I mean, like Dr. Lim said, there are several countries that we could have learned lessons from in terms of just following guidelines and taking suggestions from the scientists. And I think that would have helped. I mean, if it was hypothetical and I could do it, I would do it. Nationwide mask mandate.
I think, thank you for bringing that up, Preeti, because I feel like it's such a big issue now on kind of mandates versus individual rights. And I know we just heard your opinion on that. So Dr. Lim, if you wanted to add anything to that or what you believe is a good way to kind of converge those two ideas?
Oh, that's always going to be a big question, isn't it? Individual versus the whole. Um, it's a little bit political there.
If you
But
don't want to answer, I understand.
even right now, we know that some states have lifted the masking mandate. So I'll have to say, I think it could there's ways to do it. You could be uh, more of a strong recommendation rather than a totally forced, forced mandate. Probably, I don't even think in the beginning it was, maybe emphasized as heavily as it could be, but.
Okay, great. Thank you. Okay, so to diverge kind of from the topic of COVID-19, we wanted to ask because, as Ria mentioned earlier, there are a lot of our attendees who are interested in medicine or laboratory research. So we just wanted to ask if there's anything you would like to speak about, whether it's like an introduction of your field or just anything you want to say about your job. And Dr. Lim, if you want to start with this one.
Oh, okay. Well, so as the introduction said, I'm a pediatrician. So, I take care of babies from birth all the way through up to college at times. And I would say it's been such an honor and privilege to be able to be in my profession, and to see so many children grow up from being a tiny baby to now, graduating from high school and, even sometimes college. Um, Again, who knew we were going to be in a pandemic, if that would ever happen to us? But thankfully, our practice, and also I would say the world is coming through this. It's amazing how much research has been done and how far we've come in just a year. It's a lot of responsibility being a doctor, but it's also such a huge privilege and honor as well.
I did, when I started off, I knew I liked biology. I wanted to do some form of biology was what I started off. In India, you don't get so much guidance like you get over here, like there's no path that, they don't let you research so much, or rather that's not how it's normally done. So I ended up doing my pharmacy back in India. But then when I started working, I realized that I'm actually I started in a industry, plant biotech industry, and I got super excited over there. And then I decided I think I need to do my PhD. So I went, I got an admission to at University of Bonn in Germany to do my PhD. And that's where I loved it so much, because it's like, it's very fascinating. It's like you're actually looking at it at a microscopic level, right? You're trying to understand the function. And at that time I was trying to understand the function of keratin genes. Keratin is what you find in your hair, but actually there are like 54 different keratins. And why is nature made that you need 54 different keratins? And if you don't have one keratin, then another keratin a keratin gene just compensates for it. So, but why do you actually then have 54? It's like this functional redundancy. The nature's evolution. It's like amazing, right? So I started researching on that, got super interested. And then I did my postdoc. Again, at that time, I was looking at a gene function during embryonic development, also excited. But then eventually when I moved to UCLA, I started to work with a fibrotic disease of the lung called idiopathic pulmonary fibrosis. And there is no treatment, no curative treatment other than lung transplantation. And so we were trying to understand more in depth as to why this disease occurs and why is there no drugs out there to kind of treat this disease. And when looking at it at a cellular level, it's so fascinating, because now you're beginning to look at genes, at proteins, individual genes, individual proteins, and see exactly how they signal from one cell to another, and all of this very, very basic biology. And it's fascinating because it's so exploratory. And so now you start coming in and saying, okay, if I manipulate this gene or this protein, I'm able to modulate this effect in a cell, and that probably could help a particular biological process to be reversed. And so that's the kind of research that eventually we went into. And when I was at UCLA, we did some basic level of drug discovery research for fibrotic diseases, got super excited. And then I moved to industry where I continue to do very basic research. So it's exploratory research where we're trying to find new kind of concepts every time to kind of target these fibrotic diseases. So it's, if you have the passion, it's super exciting. So anybody who's interested in entering biological sciences, I would strongly recommend it and encourage it. And especially if people who are going into medicine in college. So when I was at UCLA, that's where I had constant exposure to pre-meds, where they would come into the lab to get lab research experience. And so most of my undergrad mentees have been pre-med students, and there are some who are there just to get a box check, but then there are also some who get like very excited to then go on to do an MD PhD kind of a program. And so I would definitely encourage people who are trying to do their medicine, if possible, while they are in their university, to approach labs to kind of give it a try. I mean, you go check it out, see whether you like it, and who knows. I mean, and that could also kind of shape your career as to see like what exactly you want to eventually do your specialize in your medicine. You know, it could be, say you're in a cancer lab, actually trying to figure out why a particular cancer occurs, and then maybe you become an oncologist or some later on in life, who knows. So, but I would encourage students to definitely try it out at university. Yeah.
Thank you. So, I mean, personally for me, like, even in high school, I think both Rhea and I have both experienced the lack of women in STEM classes, especially I feel like the higher you go up, the less women there are. So, have you ever felt that there was a lack of women in your STEM career? And do you have any advice for women that do want to go into your STEM careers? Preeti, if you want to start with this one.
I have actually personally not seen a difference. Like we've always had a balance between in science, in biological sciences, our labs have, or my university has always been like an equal balance between men and women. Unfortunately, no, I have not seen a difference. And it's the same. Maybe I would say once you go higher, as you say, it becomes a competition between a male dominated in general society, or the leaders compared to the women. So then you tend to, you're seen as a little more aggressive when you try to kind of make a place for yourself, you know? And that is also changing, because there are a lot of programs that support, like grants that support women in science for exactly this reason, so that they kind of help women actually thrive in research as well. So personally, getting in, I've never seen a difference. Maybe as you go up, as you kind of try to climb the ladder, it gets a little challenging. But again, that is, I think the system is really trying hard to kind of bridge that, or rather narrow that gap.
I would say in medicine, I don't think I've seen a huge difference. The ratio is pretty even as well. And in some fields, in some specialties, is maybe even more female predominated. Like pediatrics is probably more female predominated now than male. So, and there's a lot of women in medicine. So I think the gap is pretty much not there anymore in medicine. Maybe certain specialties. There are certain specialties that probably attract males more than females, but overall, I would say it isn't as different as it used to be.
That's great to hear. Thank you. And I just want to say, like, for everyone watching, don't be afraid to pursue these STEM fields because, I mean, very clearly there's a support system there for you. So I just wanted to say that. Okay, so we do have a lot of Q&A questions in the chat. So if you have any, please continue to put those in there. And I think we can conclude the interview round of the event. So thank you to both Preeti and Dr. Lim for your flexibility and advice when it came to answering our questions. Okay, so the first question we have is for Preeti, and this person is asking about your work in Connecticut. Okay, so it's an anonymous attendee, and they asked, you said that you had to work in Connecticut. Where in Connecticut did you have to work? Asking because I'm going to college in Connecticut and wondering where it is.
Oh, so this company is, it's called Bering Ingelheim, which is it's just 60 miles from New York. It's in a place called Ridgefield. So it's just, if you're going to Yale, or Connecticut is a small state. You can get anywhere within like an hour or hour and a half. This is just the border of New York and Connecticut.
Thank you. Okay, next question is for Dr. Lim, and it reads, what do you believe will happen for COVID vaccines for pediatrics?
I know that they're actively testing them now for younger kids. The Pfizer vaccine was tested for 16 and older, and the Moderna for 18 and older. And I know there are studies in place to at least test for 12 and older first, and then eventually probably kindergarten and older. So depending on how the studies come out, they're coming, but it's going to be a while before the tests can be completed.
Okay, so this question is for both speakers. Preeti, if you want to start with this one. So it reads, why did you choose your career and what do you find most rewarding about your career?
Oh, I think when I started the industry, like I mentioned, just the curiosity, I think just the unknowns that are out there. And when you're looking at it at a cellular level and how, I mean, the first time I looked at the electron microscope, when I imaged a particular cell using an electron microscope, and I was like fascinated, saying like, oh my God, I've seen this in textbooks and I actually seeing it like right there, you know? So I was so fascinated when I saw mitochondria and the Golgi, and like, I was so fascinated by just the basic science, like a cell, how it works. So I was very fascinated by that. Now, rewarding is actually when you figure out why something happens. Like, for example, when a cell moves, like what exactly is happening. And it's like you think of the brain, you think of the neurons and you think it's like so complex, but just imagine if you're thinking about one neuron and what happens inside that one neuron. Like there's so much that happens and it's so complicated and so complex, yet so fascinating. Yeah, it's very rewarding when you figure that out.
That's a true scientist. For me, I feel like I kind of found my path as I went along. I was actually a math major to begin with, and went ahead and took the prerequisites for medical school in case, mainly because my parents suggested that would probably be a good career to go after. And so I did that, and I got into medical school, and found that I really enjoyed it. And in medical school, then you have the option of figuring out which specialty you might be interested in by going through all the basic ones like pediatrics, OB/GYN, surgery, internal medicine. And so pediatrics is the one that settled with me to be the best option. And I really feel it's been a blessing that God led me that way. And I've grown throughout my career all these many years, and I felt like truly I found the right calling for me. And the rewarding aspect, I think I mentioned earlier, is just seeing our patients grow through the years and getting to know the families, and of course being able to diagnose things that need to be diagnosed and getting the help that the patients need, of course, is also rewarding.
Great, thank you. Okay, so our next question kind of touches on the social aspect of the pandemic. And the question is, how has the pandemic exposed inequities in your profession? And Preeti, if you want to start with this question.
Not sure. You said, how has the pandemic affected? No.
I think kind of what this person's asking is expose like unfairness or inequality, whether in people that you work, like your coworkers, or the people that maybe receive your product or your patients that you have.
Yeah. So I wouldn't say it's necessarily affected me, but what I noticed, and this is my first industry job, so I'm not sure that I know the way that how it normally works in terms of promotions and things like that. So, but what I noticed was there are a certain set of people who came on site to continue their work, like took the heavy lifting, while several people couldn't because of either family commitments or just one was not ready to come on site. So they continue to work off site. So then there was this, I think when the time of promotions came in, they felt it was unfair for people who came on site and who did not get a raise or a promotion, and it was similar to the people who did not come back on site. And I think that's a very delicate topic, only because you cannot be forced to come on site just because of the pandemic, right? Like so that you have to be very sensitive about that issue as well. But I felt like the impression that people were having in the company were like people who were coming on site were treated unfairly and not really given the um, benefit of being there, just with promotions. But personally, I never felt anything.
For us, there wasn't anything in our group that had that sort of problem. I guess what the main thing I would say just within the practice would be more for the patients. As I said, we had to go to telehealth pretty early on, and depending on how good your internet service was and your access to a computer or smartphone, it could limit how well the appointment could go because of that technology. So that would be how I would say, not within the practice, but as far as the professional part of it goes, but within the patients.
Definitely. I think a lot of students can even empathize with like not having a stable internet connection. I know sometimes, I mean, even for me today, my internet completely cut off during class and that was an issue. But yeah, I think that's a great thing to bring up. Okay, so our next question is for Dr. Lim. And this person is asking about your experience in the Air Force. So they ask, how was your experience in the Air Force? What was your path to get there?
Oh, okay. Well, I was very fortunate to get an Air Force scholarship that paid for my education, both for my undergrad and my medical school. And so to get that, I had to serve time. And so that's how I ended up in the Air Force. So I did my residency in the Air Force, and then I spent the next 8 years after that paying back my time. And it was a lot of very good experience. It's usually a smaller practice, like 2 or 3 pediatricians, versus my practice right now has 6 full-time and a couple of part-times. So that makes a big difference. There's a lot more burden of the responsibility on you. You could be stationed in a more remote location, and if you have somebody that really needs more help than what you have in your immediate hospital or your immediate clinic, that could be challenging to get them to the place they need to be. But lots of really good experience as a background from my early years of being a pediatrician.
I also kind of wanted to ask, specifically, I don't really know about the Air Force, but I do know that some branches of United States military service is more male dominated. So did you ever experience the effects of being kind of in a male dominated environment?
Yeah, well, not Maybe a little bit, but not terribly, because we were still within the umbrella of being doctors within the Air Force. And I would say in general, probably the Air Force has more, is not as, is more lenient that way. Probably the Army or Marine Corps, of course, is not as female populated. So,
Okay,
yeah.
great. Thank you. Okay, so our next question is, what steps can we take to address the social issues kids will face due to the remote learning that resulted out of the pandemic? Preeti, if you want to start with this one.
That is so complicated and yet so important, I think. And I think as a society, uh, a lot needs to be done at home. A lot needs to be done, and I think educators as well need to kind of pitch in. So it's from what I don't have kids, so unfortunately I will not be able to say. I mean, tell you out of experience how they feel, but from at least what I, I what I think should be happening is um, there should be a good understanding between parents, educators, and the society, right? So in order to be able to reintroduce the kids back to school. I mean, I even saw, I think, a post today, somebody, sorry, this is a little bit of a joke, but like a kid goes back to school and she starts telling her father, I think I've been here before. I feel like I'm back in my past life. I can remember something from my past life. And it turns out that actually it's the school that she was going to, and she just feels like it's her past life. And probably it is in a way, that's what it is, because now you're going back into a new life. And it's honestly, I think it's very complicated to say exactly what needs to be done, but it has to be done very systematically and very carefully, because kids are not, as Dr. Lim said, the biggest challenge that they're seeing is like the psychiatric issues that are associated with the COVID. So which means you would have to say, for example, I'm blanking as to like what's more important. I mean, it's going to be so challenging, and I think we need strong policies. And I think maybe Dr. Lim would have better insight into this than I do.
Well, I think the fortunate thing is, for the most part, children are so resilient. And so even though there's a lot of them are struggling and there's all these other issues coming up, I think when I've been asking my patients when they come in for their checkups how they're doing with the distance learning, I'm surprised by most of them are okay with it. Most of them say in the beginning it was much more difficult, that they had to get used to it. It is hard being in front of the computer for so many hours. But it sounds like the majority of them have adjusted to the best ability that they can. I think it's almost harder for the parents, especially the ones with younger kids that are also working from home, because they're having to juggle helping their child do their school online, because they need help even though it's online, like navigating the computer and whatever else, and then them also doing their own job. But hopefully once things get in place, and hopefully very systematically and in a safe manner, hopefully we can find a way to catch our kids up to where they need to be. The educators, I think, are doing their best to figure that things out, just like every other profession. And I have hope and faith that they're going to figure out how to catch the kids up as well, and the kids themselves.
Thank you.
May I ask a question while we have this discussion going? Is there a lot of pressure from just the community, from the students themselves, not knowing what's going to happen when they go back? So could it be like an effect where, of course, everybody is now stressed about going back to work, but could that also be like just how do you say it? So are you aware of it, or are you like conscious that there could be a problem, or are you just afraid, or are you do you really feel it and sense it?
This question.
Me as
The kids, like
or
you
kids.
see them, yeah, kids.
Okay. So I think, I mean, personally, this we are sorry, I'm trying to gather my thoughts. My district is going back to school most likely in a few weeks, but this is actually the second time that they've told us we'll be able to go back to school, so we'll see how that goes. But I know definitely during the first time they told us, which was in January, I think there really was a lot of pressure to really go back and see everyone because I mean, now it's almost been a year. But I think the second time around, it's definitely less in a sense, and I feel like just everyone is more tolerant of other people not wanting to go. And I mean, personally for me, I don't feel as much pressure because I feel confident that by staying home and maybe not participating in some activities, I'm keeping other people safe. So I think it really depends on the student. I mean, having that said, I am planning on going back to school, but being safe, of course, while doing it. And I think it really does depend on the student, but for the most part, there definitely is a lot of social pressure in terms of hanging out with your friends, and the mask wearing, I think for sure is peer pressure. I think, yeah, that's what I'd have to say about that.
Thank you.
And I think that actually is a great transition to our next question. And this person is asking, how can I help my peers/friends understand how serious COVID-19 is? I often feel awkward enforcing social distancing, and some of my friends take it the wrong way. Dr. Lim, if you want to start with this one.
Well, that's a question for the ages because adults have the same. I mean, there's a lot of adults that feel the same way. Some take it more seriously than others, as you can see if you look at the news at all or hear, different things going on in the world. I think you just, state the facts to them that, these many people have, over 500,000 people have died already, and many families have been affected by someone who has COVID, whether it was just a brief illness, thankfully, or someone that has ongoing symptoms, because there's people that have that, and the more sick people that have had to be hospitalized. But in the end, that person's going to have to make their own decision. You can't always convince them to your side. You can only just do what you can do. You only have control over what you can do. So if you want to if you mask and you keep your social distance, that's what you have control over. You can't really force the other person.
Exactly. Don't give in to peer pressure. Wear your mask and social distance. That's it.
You do your part.
Thank you. Okay, so I know we're running a bit out of time, so if you have any questions, please put them in the chat now. And our next question is, how can I, as a male, make an environment that is welcoming and open for my female colleagues? Preeti, if you want to start with this one.
Just be aware, right? Like in terms of be sensitive to the person, which means like don't make it awkward. Be sensitive to the way, no loose conversations, but treat them as equals. And I think that's the minute you treat them as an equal and nothing else, I think everything else falls in place.
Yeah, I agree. Treat them as equal and treat them with respect.
Yeah.
But any other person.
Thank you. I think even just asking that as a male colleague, that's a really great first step to take, I feel like.
Yeah.
Okay. And then our last question is, what is the most challenging part of your occupation? Dr. Lim, if you want to start with this one.
I would say in my field, it's probably on the day-to-day is time management. We're always in the pressure of trying to be on time with our patients, and there's not every patient goes as expected. They might be scheduled a certain time slot for a certain problem, but often other problems come up, or If you're on call and something happens at the hospital, there's things that take your time up. So I would say on a day-to-day, that's the challenging thing, because pediatrics, you do see a lot of patients every day. The other challenging part, of course, is trying to make sure you don't miss any important diagnosis that a patient might have. There's always that, feeling, am I diagnosing and treating this patient correctly and fully? So that's the other hard part.
And in my case, as interesting the unknowns are, that's the challenging part as well, because sometimes, and the biology is so different across different samples. So it's like one set of samples works one way, and then the other one might just work the opposite, and you just don't understand why. That's the interesting part, but still yet the challenging part.
Thank you. Okay, so with that, I don't see any more questions, so I think we can conclude our audience Q&A round. Thank you so much, panelists. I know we jumped around a lot, so I thank you for your flexibility and your insight on answering these questions really well. And before we finish for the day, I would like to remind our attendees about the scholarship opportunity that Ria and I have put together, and I will drop the instructions in the chat. Okay, so that should be the scholarship instructions. And then, if today was your first time attending a Femme4STEM webinar, please make sure to come tomorrow in order to fulfill the 2 webinar attendance requirement in order to be eligible for the scholarship. That is also on the instruction that I just sent out. And we hope you'll participate in this opportunity, and we are also looking forward to reading your stories as a female student in STEM. Okay, so once again, thank you so much for attending, and thank you to our panelists for being flexible. And I know we did lose my partner Ria due to electricity issues.